Cardiovascular disease, number one killer, men and women, not just here in the United States, but worldwide. And we know that the biggest driver of that is the cholesterol problem. And I'm so glad you called it a crisis because we like to think about this as a fire within. It's literally the silent killer because people don't come to a medical office saying they're complaining of high cholesterol, but inside it's causing so much damage. And one of the things we've learned about cholesterol is that we need to lower it earlier in your life. So this is something we started calling cholesterol years of exposure because it's a poison. Too much cholesterol is a poison for the arteries. And we used to think 10 or 20 years ago that if your cholesterol is mildly elevated or moderately elevated, we could just leave you be. We would only be treating the ones that are severely elevated. Now we've turned that thinking on its head and said, actually, let's start treating people in their 30s so that it never actually deposits into the arteries. And we need to treat people even who are mild or moderately elevated because that's too many decades of exposure to this poison, which then triggers inflammation, then triggers blood clots, and then triggers heart attacks and strokes. I think we're failing our women more than we're failing our men. In fact, overall, I think we're failing because we're not as good at predicting cardiovascular disease as we ought to be. Our approach for the longest time has been reactive, where we wait for the heart disease to manifest itself. You have that heart attack, you have that stroke, and then we put you on the right medicines. I think we need to be proactive because we know that statistically, this is the most likely thing that's going to happen to every one of us. So starting in our 20s and 30s, we need to start checking the blood tests, checking other tests to try to figure out how to predict disease. And especially in our women, I think one of the problems has been that a lot of women even perceive heart disease to be an old man's disease. They don't think young women can get it. They don't think older women can get it. And in fact, what we know is that women don't just have the traditional risk factors for heart disease, high blood pressure, high cholesterol, diabetes, obesity, et cetera. They also have specific risk factors to women, like menopause. A woman goes through reproductive life cycle where her estrogen goes up and then it goes away after menopause. That is a huge risk factor. A woman carries a pregnancy, and that's not something a man does. But what happens during your pregnancy, which is blood vessels forming the placenta, that predicts whether or not you're going to have heart disease. So I think we need to get better about predicting disease in our women and also about empowering them to know their numbers so that they know their risk and they can really manage that risk. I would like to say as a physician, cholesterol is one of the most challenging things that I treat because it's asymptomatic. You don't know that you have high cholesterol. If you have high blood pressure, you get headaches, you get blurry vision. If you have a urinary tract infection, you know about it, but that cholesterol is causing that damage inside so you don't get it. So the biggest reason is that it's asymptomatic. Women don't realize that it's a problem. The second, I think there is this fear, and it's really a misinformation that's come out of social media and the internet and what have you around cholesterol medicines and what they could do. And people worry about side effects. People worry about something called dementia. As they get older, they worry about stroke. And in fact, what we know is that if we keep your cholesterol, your bad cholesterol below 70, that's a number called the LDL cholesterol, we can reduce your risk of having stroke, which we worry about the most, of having dementia, and if you're a man, even having erectile dysfunction. So treating cholesterol early actually reduces all those bad things that we worry about so much because social media and the internet tells us that statins can cause side effects and what have you. So we're turning our back on a life-saving medication because we don't have symptoms and because we worry about side effects. Clinical trials have over and over again shown that the lower we get your cholesterol, the more we reduce your risk. In fact, there's even a number. Every 39 points that I drop your bad cholesterol, your LDL, I reduce your risk of heart attack, stroke, or dying from heart disease by 22%. So that's a clear math problem, right? We want to live longer and we want to live better. And reducing your cholesterol early in your life allows you to live longer and live better, which is why we need to start embracing medications like statins that can lower your cholesterol risk. We've now realized, however, as cardiologists, that in addition to cholesterol, there's other pathways. Inflammation is a big pathway. So assessing our inflammation and thinking about reducing it with lifestyle measures, maybe even medications, that's a second pathway. The third pathway is thinking about this genetic risk called lipoprotein A, which is a fat marker in the blood that can predict our risk as well. And we have medications coming that can reduce that. So really thinking about all the different ways in which we can reduce your risk: cholesterol, inflammation, lipoprotein A, as well as all the lifestyle measures, doing the 8 things in your life's essential 8 that the American Heart Association recommends that can reduce your risk of heart disease. So I would send you to two places. The first, the American Heart Association's Life's Essential 8 website. So go to Google, type in AHA Life's Essential 8, and that's a fun little website that lets you actually plug in your own, what you're doing, your own numbers, your own risk, and it spits out for you what you could do better. Because we know that 80% of heart attacks and strokes are preventable with the right risk factor management. This helps us to know what we're doing good at, what we can do better. The second, I would say, if you want to read about inflammation and about the study and how to predict heart disease risk using inflammatory markers and others, cvdinflammation.com is a great resource to learn more about inflammation and heart disease.